Actually, I hate to come after Peggy, to tell you the truth. I've been working with Peggy for 3 years. I've been trying to fight to keep Earl K open. I was a single mom, raising 2 kids, working hard, doing the way, like Georgina said, I was trying to live the way you're supposed to live. A little closer. And something really tragic did happen to me. And I didn't know what I was going to do. And through the grace of God, and when I say the grace of God, I mean it. I had the covenant of the Lord over me. I ended up here. Through my private doctor that I went to, Dr. Susan Risharm, she got me to Mid-City Clinic, then to here. My situation was a little unique too, because my heart is so broken over this dissecting and taking Earl K apart and putting internal medicine one place, which Our Lady of the Lake, nothing against them, but they don't do GYN. They're only taking the internal medicine. So in them only taking the internal medicine, then they're trying to work something out with women's for the GYN. In my particular case, I had blood clots in my lungs, and my life was truly on the line. And had I not been here, I honest to God don't think I would be celebrating life today. And I know that with all my heart. So every single day, I thank God for this place and everybody that works in it. And what Rick said is so true. It goes from the doctors, the cream of the crop. I had Dr. Jacob Esses and I had Dr. Giles Fort that did the surgery on me. And they were teaching the med students. And all the interns and all of the people that work here, down to, like Rick said, the aides. The care here was phenomenal. And I speak it from the rooftops, and I have for 3 years, because there is nothing like it. But the thing is, what's going to happen with the hospital closing? We're not going to have a safety net hospital in Baton Rouge, our capital of Louisiana. There is something really wrong with that. Because you see, Medicaid patients will be going to hospitals, but you won't have something nearby for those that are in need. They got to travel pretty darn far to go to get care right now. And secondly, there's about 25% in Louisiana that work hard, but they can't afford health insurance. And so this was a safety net. And people, what really hurt me was when I would go to town hall meetings, and I don't think they intentionally meant it, but when a few people, when they would talk about Earl K they'd say, what about that money pit, Earl K And I would send up, when I go to Bill Cassidy's, I live in Southeast Baton Rouge. I would come over here to North Baton Rouge to town hall meetings. I was going everywhere that anybody would listen to me. But what I would do is I would say, since when is educating our brightest in Louisiana a money pit? There is something so wrong with the mental concept on this. And I don't believe going private with a public university learning hospital is going to save this state any money, everybody, because it's not. Because it's going to actually cost more when it all is said and done. And they could have kept this building, not this building, excuse me, but kept the foundation of Earl K. They just needed to change the building. That's all that needed to be done. Because this institution ran like a well-oiled machine. And it is sad, and I am so disheartened over this. And I just pray to God that people open their hearts and try to understand what this means for all of us, no matter what side of the aisle we're on, no matter what our backgrounds are. This affects the entire community. So let's all keep Earl K. in our prayers, and we're lighting our candles in to keep the light of Earl K. in all the public hospitals alive. Thank you.